Good afternoon. Today I'd like to talk to you about the importance of breastfeeding infants. All the information gathered here is from La Leche Ligue International, Breastfeeding A through Z. Infants should be breastfed because breastfeeding positively affects everyone by positively affecting both mom and baby physically, emotionally, and psychologically. How do these changes occur? Well, breast milk composition, milk changes, and even the saliva and the infant's contents. So today we'll be going over what is breastfeeding, what is breast milk, how does it change, how does it affect mom and baby, what are some problems of breastfeeding, what are some solutions to these problems, how does breastfeeding compare to other alternatives, and the conclusions of breastfeeding infants. Breastfeeding is the act of allowing baby to receive food from mom's breasts. Breast milk is a naturally made, nutritionally sufficient food for babies, aiding them in physical growth, brain development, and even immunity. It is 100% nutritionally satisfactory for infants 0 to 6 months, but it can have beneficial effects throughout toddlerhood as well. Breast milk changes in its form from colostrum just in the first few days, into transitional milk in the first couple of weeks, and then finally at week 2 it graduates into mature milk. Breast milk changes in composition to adjust the baby's needs, not only in volume based on the baby's growth rate, but also in contents based on the baby's gender, which mom can detect in utero through stages of either testosterone in boys or estrogen in girls. Breast milk will continue to be produced as long as mom breastfeeds baby. Oxytocin is released when breast milk is released, so this can help baby to form a healthy relationship and bonding between mom and baby, and can also reduce mom's risk of developing postpartum depression after she delivers baby. Breast milk contains other hormones as well, such as melatonin, which is released during the nighttime to help baby sleep, and serotonin and dopamine, which can help the baby in its mental state. Babies will also consume mom's calories, so this can help baby to grow strong and healthy and also help mom to lose those extra pounds that she gained during pregnancy. Breastfeeding allows for continued communication between her and her baby. When the baby drinks the milk, some of the saliva is backwashed into breast milk. If the baby is ill, some of those pathogens will go into her breast milk. Her body can detect this and make antibodies just specifically for that pathogen. This can aid the baby in defending against the common cold, something as serious as the measles, and even help attack cancerous cells later on in life, such as leukemia. Breast milk has also been found to reduce the risk of childhood developed asthma or even ear and respiratory infections, among other things. Mom can contribute to a healthy intestinal flora by delivering healthy bacteria that act as probiotics. This can reduce the baby's development of things like colic and irritable bowel syndrome, and even reduce childhood obesity. Breast milk affects brain development as well, which can increase the child's IQ and even lower the risk of sudden infant death syndrome by developing the parts of the brain, such as the medulla oblongata, which is responsible for keeping us breathing and our hearts beating even while we're asleep or unconscious. Breastfeeding can also reduce breast cancer and osteoporosis for mom. This is due to the fact that some of her calcium will be extracted from her bones in order to deliver it to baby if diet is insufficient at first. But after breastfeeding is over, her bones will regain its strength and be stronger than ever before. Moms can also shed their breast cells when they breastfeed, which can reduce the risk of malformation of cells in her breast, eliminating the risk of cancer. Lowered estrogen levels during breastfeeding can not only reduce those risks, but also can act as a natural birth control, allowing her body to heal between her pregnancies. And of course, diet and exercise are very important during breastfeeding, so this can encourage a healthy lifestyle for mom and for baby, because babies will eat whatever mom eats. This will extend the baby's palate, allowing them to integrate into their cultural norm of eating, and also why moms should limit their drug and alcohol use, because that can be transferred into the breast milk as well. Again, this can encourage moms to live a healthier lifestyle. So what's wrong with breastfeeding? What are the counterclaims and problems? Well, is breastfeeding inappropriate or sexual? Of course not. Breastfeeding has been around since the beginning of time. Ever since humans have existed, breast milk has too, because all mammals breastfeed their babies. It is as natural as giving birth. Is breastfeeding lead to sleep deprivation? Will it drain all the energy? Well, breast milk can go through the baby's digestive system a little bit faster than formula can, but in fact, breast milk contains melatonin, which can help the baby to sleep at night, and delivers other hormones like oxytocin, which can give the mom a natural energy during the day. Will breastfeeding keep babies really close to mom and keep them dependent on mom forever? No. In fact, the dependency on mom is completely dependent on her parenting style and their behavior between them both. And in fact, breastfeeding can encourage a healthy relationship between mom and baby, allowing the babies to be psychologically satisfied, which can encourage independence. And how does breastfeeding make mom feel? Can it make her feel loss of autonomy? It can. But this could happen through bottle feeding as well, as babies should be held while they're bottle fed. And this can take a lot of time during the day, especially when they're so new. But in fact, mom's milk is specifically made just for her baby. So feeding her baby and having that come from her body that she's made, just as she's made her own child, can make her feel really empowered. Breastfeeding, is it taboo? Is it wrong? Well, thankfully, the case of moms having to breastfeed in public bathrooms while they're out is becoming a thing of the past. And in fact, breastfeeding can be done anywhere and everywhere when the baby gets hungry. Breastfeeding is legal. Publicly breastfeeding is legal in all 50 states. Can you breastfeed while you're working? If I have a child and I choose to breastfeed, can I not work? Of course not. In fact, a lot of employers are becoming more baby-friendly, allowing children to come into the workplace in the office in a certain area where you can go and breastfeed them throughout the day, or even allow you to take your work at home to be with your child in their own environment. And since you can pump during the day while you're breastfeeding, this can be really freeing, as moms can pump while they're doing work as well. And what about the inconveniences of milk letdown? Even the slightest baby's cry can release the milk, and it can stain mom's clothes and lead to embarrassment. This is very true, but there are breastfeeding bras and pads that you can insert so that this does not occur. What about difficult suckling problems leading to pain? This is a problem for a lot of new moms, and most of the time it is due to a insufficient suckling position and latch, which can be helped by consulting a lactation specialist. But there are also different alternatives out there, such as a nipple guard, which can deliver relief. And what about painful breastfeeding conditions such as engorgement? This is due to an overfill of the breast tissue. So if baby's not suckling enough releasing that milk, alternative methods of breast milk excretion, such as hand expression or breast pumping, can really relieve that pressure and eliminate that issue. And other breastfeeding conditions like mastitis, well, this is an infection due to a clogged milk duct. So the best way to get rid of that, to avoid that issue, is just to make sure the breasts are very clean, and also to make sure that there are no cracks where blood and other germs can get in there and get infected. So there are soothing solutions such as nursing bombs, which can be applied to make sure that the nipple is pliable and soft so this does not happen. And what about a shortage in breast milk from the mom? What if she can't make it, or what if she's not making enough? And how do you know if the baby's getting enough, because you can't measure it like you could in a bottle? Well, this is very true. But if the baby is growing at a healthy rate, this should not be a fear factor. And if the mom is having a shortage issue, her milk supply can be increased by either taking supplements or by changing her dietary intake through different foods. And what about serious breastfeeding conditions for the mother? Like if she has cancer or AIDS or some other kind of blood transferable disease, or if she's taking medications that could be transferred through her breast milk. These are very serious concerns, and though, again, they may not be very common, they should be addressed. Breast milk donations through a mother who is already breastfeeding, who can share her breast milk with that mother's baby who was unable to breastfeed at that time, or even for the entire duration of her baby's breastfeeding childhood, is a really great alternative that is becoming more popular again. What about breastfeeding complications for the infant, such as galactosemia, which is an inability to metabolize a simple sugar found in breast milk, or PKU, which is an inability to metabolize an amino acid found in breast milk. Both of these complications, if not addressed, and the children are allowed to continue breastfeeding, can not only damage their physical body, but can also cause a lot of cognitive damage as well. So there are other alternatives out there, such as lactose-free milk from cows where that lactose has been extracted. There's rice milk or different milks derived from other plants or grains, and there are other formula-based milks out there that are going to be safe options for them. Unfortunately, breast milk is not one of them. So let's look at breast milk compared to formulas and other alternatives. As you can see, we have tried to mimic breast milk with formula, but unfortunately that's just not possible at the moment, and breast milk really is the most superfood that we can give to our babies. As far as a milk delivery system, the breast is truly best in this scenario because it is air-free, and of course it's not completely sanitary. As we know, it delivers bacteria and all kinds of other things. But again, this is good because it can detect babies' changes even throughout the day and change according to the baby's needs. And again, because all mammals deliver milk specifically for their babies, animal milk is species specific. So humans make milk just for human babies. Goat's milk is only made for goat babies, and cow's milk is only made for cow babies. Even though they may be close in some ways in composition, it is not a true replacement. So in summary, babies should be breastfed because breastfeeding positively affects baby psychologically, emotionally, and physically. And moms should breastfeed babies because breastfeeding positively affects mom of the baby physically, psychologically, and emotionally. While breastfeeding starts to have beneficial effects on both mom and child during infancy, it can have beneficial effects throughout toddlerhood as well. And we should care about breastfeeding because breastfeeding affects everyone by positively affecting both mom and child physically, emotionally, and psychologically. And here are the references for where I've gathered this information. Thank you.